Labor and delivery is a unique and powerful experience. As a first time mom, or maybe you are not even a first time mom, but you want to learn one or two things about how to navigate your way in order to make a right decision or in order to make an informed decision during labor, don't go away. Just grab your seat. Let's navigate your choices during labor together. The first decision to make in planning of your delivery is choosing the place you want to deliver your baby. Is it in a primary setting? Is it in an hospital setting? Maybe secondary facility or tertiary facility? Your decision should be based on your own condition and your baby condition. Or do you decide to deliver your baby at home? But it's more preferable to deliver in health facility when you are living in a developing country. In advanced countries, you can actually decide to have your baby at home and being monitored by a licensed birth attendant. Another thing that can influence your choice in choosing where to deliver your baby is that your previous delivery history or pregnancy history. Do you have history of eventful labor, obstructed labor, or you have a special child that that is as a result of circumstances surrounding the birth of the baby, which cannot be explained the reason for this. So you have to make a decision to choose carefully where you want to have your baby again. Another thing to influence your decision is if you are multigraphida, maybe you have delivered more than 3 times before, it's essential you actually deliver in an hospital, irrespective of where you have been delivering your baby before. This is an important decision for you to make if you have been having birth more than 3 times before. Another choice that you need to make during pregnancy in preparation for your delivery is for you to know the teams of the that are going to attend to you, the personnel that will be present during your labor. Does the facility has midwives? Are you going to have a midwife attending to you during labor or a licensed person to take care of delivery? Or is the facility you are delivering your baby has an obstetric and gynecologist doctor? It's not everyone that is trained to take delivery. So it's essential that you know the type of personnel that will be attending to you during your labor. So for instance, there was this video that was circulating on social media some times ago about a pregnant woman, which, which is not a, a palatable thing, that an hospital actually rejected because they said they cannot take care of her. We have to know that it's not every hospital that is equipped to take care of obstetric emergency. If the personnel or the doctor that they met on duty on that day wasn't trained to take care of an emergency, and he or she thinks that it's better to transfer than doing more harm to the woman. So you have to know this thing. Who are going to be present during your labor? Who is going to attend to you is so essential. Another thing is about the finance aspect. Maybe you are thinking about monetary factor, or maybe you are even telling yourself, all things said and being done, I should be saying what I want to say is about money. Money is very important in planning for the delivery of the baby. If you are something that you are not financially okay or stable to produce these a lot of money at a time, it's better for you to plan ahead and register for an health scheme. You don't have to be a salary earner, you don't have to be, even if you are a self-employed, you can actually make a health insurance plan for yourself and your family. But it's important for you to do this as early as possible so that you'll be mature and you'll be able to access it when you need it, when you want to deliver your baby, or when your wife, your partner wants to deliver their babies, is essential. There is national health insurance scheme. You can ask around where you live. There is states, also states are even involved, like Oyo State. And don't forget to speak with your healthcare provider about any concern that you are having, so that they will be able to guide you based on your health status, your baby health status in pregnancy is very important. Just make sure that you know that what comes first is your health, and your baby well-being is so important. I've come to the end of this video. Thank you for watching to the end. Don't forget to click on the follow button and follow for more health tips. Don't forget to subscribe if you are watching me on YouTube. Until next time, I will be doing another video like this. Take complete charge of your health. Bye for now.